we are talking about endovascular surgeries or endovenous surgeries, where we go inside the problem and we seal the problem.
Yeah.
And in that, you told us that there is radio frequency ablation, there is laser ablation and microwave. And even though all three are the same, technically, you feel that microwave ablation is more patient friendly.
It is.
Is it?
It is.
Isn't it?
It is. I mean, from the experience. I mean, we did about 35 cases of microwave ablation.
Wow.
So, and all the patients, they were absolutely fine. I didn't have a single patient who had any kind of a burn post microwave ablation.
Okay.
And the results are exceptional.
All right.
And one thing that I want to add on to this is when you do microwave ablation, one must understand that, in the thigh, the varicose vein is quite straight, probably because of the space. It gets to expand. So even if the vein is dilated, there is a lot of space for the vein to expand and still not get tortuous. But then below knee, the vein tends to get tortuous because there is no space. So it has to accommodate by becoming tortuous. So the fiber is it's not easy to take the fiber below knee.
Yeah. You guys have to understand, okay, the point what she said. She said is, see, basically you have a deep venous system which goes inside the muscle, okay? It will be inside the muscle, in between the muscle, and the superficial one, which is outside. So the point is, as the femur is long, okay, even if it dilates, it won't become tortuous or bend too much. Whereas when it comes to the leg, as you can see, two things. One is that there is not too much fat here, okay, it will be only muscle, and also the gastrocnemius and the soleus or the calf muscles are really huge, and after that it thins out. So the possibility of the vein bending a lot here is more, as it is also shorter than the femur. I hope I was right.
Absolutely, absolutely.
Yeah.
So there is a technical challenge of taking the fiber below knee.
Okay.
Because it's tortuous and the fiber is a little stiff and we cannot the fiber doesn't track below knee that easily as compared to above knee. So what we do is we do combination treatment. We do microwave ablation for vein above the knee, and for the vein which is below the knee, we do sclerotherapy.
Yeah, that was my next question.
Yeah.
Fantastic that you brought it up. I just wanted to ask you about, I have a lot of patients who come and ask me that they have lines on their legs.
Yes.
I know that they are spider veins, and actually they have told me, sir, doctor, there is a treatment called sclerotherapy, but I have always said, why is it necessary? Is there any medical reason as to why, other than a cosmetic reason, as to why we need to repair spider veins?
No.
It's just cosmetic.
It's just a cosmetic.
So if the patient wants it for cosmetic reasons, we have a complication-less way.
Yes.
Sclerotherapy to set it right.
Yes.
Okay, that's fantastic. Oh, Dr. Deepa, I've learned so much in such a short time. But apart from this, I also know that you're a believer in activity, because you dance, you do a lot of physical and emotional confidence building activities, So I would like your opinion on how somebody can avoid varicosities from becoming worse or needing any procedure with just physical activity. Is that an option at all for people?
Certainly. I mean, I strongly believe in the fact that human beings are designed to move. That is the reason why we are blessed with muscles and bones.
Absolutely.
Otherwise, we probably wouldn't have muscles and bones. And the whole idea is for us to move. And unfortunately, over a period of time or over generations, whatever, human ancestors were not like us. And somewhere down the line, I think we lost the plot and we became so sedentary. And I think most of these lifestyle diseases, and varicose veins definitely is one of the lifestyle diseases.
I think so too.
Yeah, along with obesity, smoking, all the other lifestyle problems, varicose veins is one such entity which can be solved if somebody can move. So when I say move, people when they come to me, when they say they have varicosities, what I would say is if you are sitting for prolonged periods of time, just stand up and take a walk, take a stroll. Because if you're walking, that's not an issue. It's only prolonged standing which is an issue with varicose veins.
Yes.
So please don't stand there for prolonged periods, but then just keep walking. If it's a desk job, keep a stool or something like that and put your feet up, because even that can help. And even at home when you're watching telly, put your feet up and just get up and walk around.
Yeah.
And
The reason is that there is this calf pump complex in your calf. So basically, as I said, the deep veins are in between the muscles, and every time you tighten your calf, pressed inwards, and blood moves up. So even if you're lying down and you're afraid that you have varicosities and it will hurt, do the ankle pumping exercise so that the calf is activated. This helps pumping the deoxygenated blood back up. Yeah, that's all I wanted to say. All right. So basically we learned that varicosities could be hidden. Varicosities, if they are obvious, they don't have to remain like that. There are a lot of minimal access endovenous techniques like radiofrequency ablation, laser ablation, and microwave ablation to take care of your issues. And I really thank Dr. Deepashree, interventional radiologist. And if you have anything to tell our viewers about varicosities or anything with which they can prevent or improve their condition and move better, go ahead.
One final point that I want to say is, as we all know, prevention is always better than cure. So I think we've touched upon the prevention aspect. But there's one important aspect about varicose veins is the venous ulcers. I think we probably didn't mention about venous ulcers. Most of the patients, they ignored varicose veins, and then they come to us when they have ulcers in the legs. Now, when you have an ulcer in the leg, then we have two things to handle. We need to treat varicose veins, and we have got the ulcer to handle. Treating varicose veins is a lot easier than treating an ulcer.
I know.
Yeah, because having an ulcer, it can be extremely painful and it can be so debilitating to patients. So sometimes I feel one shouldn't get to that stage of having an ulcer. If we have something, it's like having a breast cancer. If something can be diagnosed early, it can be removed, and that's how it's a cure. But unfortunately, when somebody has an ulcer, it's not even a cure, and then for months and months one has to struggle with the ulcer, and it takes a long time for the ulcer to heal. So that's one point that I wanted to mention.
Fantastic. I think this is a fabulous point to summarize with. If you have a friend who you see has had an ulcer in the ankle region, think of this interview and ask him or her to get a vascular ultrasound Doppler done, and if it is varicosities, to get it treated. Thank you very much for listening. It was an amazing experience sharing the idea that everybody has an easy way to diagnose issues, whether it is muscular or blood supply related or nerve related. And it's my dream to keep simplifying the hard things we do with you guys so that you can understand why we do what we do. Thank you, Dr. Deepashree.
Thank you so much.
It was a fabulous
Thank you,
experience
Dr.
talking to you.
Thank you. Same here.